Knock, knock.
Come in.
All right, hello.
Hi.
I'm Allison. I'm going to be your student nurse today. How are you doing?
Good.
Good. All right. Before we start, I'm just going to look at your name band. You can please tell me your name and date of birth for me?
Shannon Titus, 839.
Okay, perfect. Okay, so today I'm just going to be doing a head-to-toe assessment on you. I'm just going to be looking at your joints, assessing your skin, looking at any like rashes or any abnormalities. Before we start, I'm just going to ask you a couple of questions. Are you in any current pain right now?
Mm-mm.
Do you have any chronic problems or illnesses that you'd like to bring to my attention?
Mm-hmm.
Do you have a history of any stroke, seizures, high blood pressure?
Nope.
Do you have a family history of any stroke, high blood pressure?
Yeah.
Okay.
Okay, so my dad's mom and dad both had heart attacks. And then my mom's dad had a stroke, and my mom's mom had breast cancer.
And do you have any joint or problems, like is it impairing your activities of daily living at all?
Mm-mm.
No? Okay. So I'm just going to start by taking your vitals. So I'm just going to use your wrist. I'm just going to take your pulse. All right, 60. All right, so next I'm just going to be assessing your respiration, so if you can just breathe normally for me. Next, I'm just going to be taking your temperature. All right, and if you could just open up. All right, 8.3. So I'm just going to start by looking at your hands. Temperature, nice and moist, dry. I'm going to be checking your capillary refill, less than 3. All right, checking your skin turgor, less than 2 seconds means you're hydrated. All right, if you could just go like this for me, and if you could just grip my hand. If you could press down, press up, and if you could just roll your wrist for me. Does that hurt at all when you do that?
Mm-hmm.
All right, so I'm just going to be... I'm just going to be looking at your skin. Feeling for pulse strong, bilaterally. Just gonna be looking nice and strong. All right, and if you could just flex for me, extend. Does that hurt at all when you do that?
Mm-hmm.
All right. I see you have a couple freckles. And if you could just put your hands up for me, put them down, put them behind your back, behind your head. If you just put them in a circle. Does that hurt at all when you do that?
Mm-mm.
All right. And if you could just shrug your shoulders for me. All right, I'm just going to start by looking at your head. Good hair distribution, nice and thick. Do you dye your hair at all?
Mm-hmm.
No? Feeling for lesions or masses. I'm just going to start by looking at your ears. Everything's intact. I see you have a couple of piercings. Alright, so I'm just going to perform a whisper test. So I'm just going to say a couple letters, and then if you could just tell me exactly what you hear. So just cover one of your ears for me.
1, 2, 3.
Alright, if you cover the other one.
3, 4, 5.
Alright, thank you. Alright, so I'm just going to be looking at your face. Skin is nice and warm. Just see a couple of lesions. I'm just going to take a picture. Alright, so we're assessing your sinuses. Does that hurt at all? Alright, breathe for your tongue. Strong. Great, thank you. If you could just clench your jaw for me. Open it up. Protract it forward. Yeah. I hear some clicking. Does that happen at all when you eat like certain foods at all?
It happens all the time, yeah.
So I'm going to perform some eye exams. So first, if you could just look at my finger and just watch it. And if you could look straight forward, I'm just going to put the light over your eyes just to make sure that they can straight. Okay. And then if you could just look at my pen here, look at the wall. Right. And then if you could just cover one of your eyes for me. All right, and if you could just tell me exactly when you see my finger.
No. No.
All right, and if you could just cover the other.
No. No. No.
Perfect. All right, next if you can just occlude one of your nostrils and sniff. And then do the other one. All right, and if you could just open your mouth for me, say ah. Right, and then if you could just swallow for me, and then stick your tongue out, move it up and down, side to side. And then if you could just smile, frown, puff your cheeks out. All right, so next I'm just going to be looking at your neck. I'm just going to be feeling pretty carotid. So next I'm just going to be feeling for your thyroid, so if you can just tilt your head a little bit forward and to the right, and if you could just swallow. Good. Alright, so I'm just going to start listening to your lung sound, so I'm just So I'm just going to inspect the skin. I see a couple of freckles. I'm actually going to measure that one right there in your back. And do you use like tanning bed at all?
Mm-mm.
No? And what kind of SPF do you use when you go out in the sun?
I don't.
You don't? Okay. Alright, so I'm just going to palpate. If you feel any pain or tiredness, please do let me know.
Okay.
Alright, so next, if you could just take a big deep breath for me. Alright, so next, every time you feel my hand, if you could just say the word 99.
99. 99. 99. 99. 99. 99.
So I'm just going to percuss now on the field. So next I'm just going to be listening to your lungs. Every time my stethoscope hits your skin, if you could just take a big deep breath for me. All lung sounds are clear. I'm just going to actually measure this other muscle underneath your skin. So next I'm just going to be going to the front and listening to them. So I'm just going to palpate your skin, see a couple of freckles, nice and warm. All right, I'm just going to palpate. Any pain or tenderness when I'm doing this? So I'm just going to be listening to breath sounds again. So every time my stethoscope hits your skin, if you could just take a big deep breath for me. All lung sounds are clear. And do you smoke at all? Does anyone in your family smoke at all? Alright, so next I'm just going to be listening to your heart sounds. Do you ever have any shortness of breath or any chest pain at all? No? Okay. So I'm going to start by listening to your aortic valve. Sorry if I take a little bit longer, I'm just listening to the full.
That's okay.
Yeah. Right now your pulmonic. And tricuspid. And your mitral. And if you'd like to, you can lay back now. Alright, so I'm just going to be looking at your stomach now. Alright, so I'm just going to be inspecting. Nice and flat. Let's see any extra fluid, some contractions or any redness. Alright, so would you say that your bowel movements are regular? How many times a day do you think you?
Probably once.
Once or twice?
Yeah.
Is the color normal? Is the consistency
Yeah.
normal? Okay. Alright, so I'm just going to start by listening to them. I'm just going to be percussing your abdomen. So next I'm going to palpate. If you feel any pain or tenderness, please do let me know. Any pain at all when you do that? Okay. Put this back on you. You can stay laying. Now I'm just going to be assessing your hips. That's okay. Any pain at all when I do this? All right, if you could just take your right leg, move it up and to the side. All right, and before you bring it in, you could just flex your knee for me and then put it back out. All right, so there's some cracking. Is there any certain times when your knee cracks more, or is there
Just
any limitations?
when I, like, bend down, but it doesn't hurt.
Okay. And if you could do the same to your other leg, just lift it up, move it to the side, back in, and then just flex it for me. All right, and there's cracking. All right. Nice and warm. So I'm just gonna measure that. I'm just gonna be feeling the pocket too. You could just push down on my hands, lift up, and if you could just roll your ankles for me. All right, I'm just going to be checking your capillary. All right, if you'd like to, you could sit back up. So next I'm just going to be assessing some of your sensations. So I'm first going to be performing, I'm just going to be touching some of stuff on your face, and if you just tell me exactly where you feel it. So just close your eyes.
Forehead, left cheek, chin, right cheek, nose.
So next I'm going to be testing your sharp and dull sensation. So I'm just going to be putting a sharp or dull object on your hands or legs, and if you just tell me like what it is and exactly where it is.
Okay. Sharp right or left hand, dull right hand, sharp left leg, dull right leg.
So next I'm just going to be assessing if you can feel if the movement's up or down. So if you just close your eyes and tell me if you feel your finger going up or down for me.
Up, down, up, up.
Alright, so lastly I'm going to be putting an object in your hand. If you could just identify what you think it is.
A pen.
Thank you. So now I'm just going to be testing your movement. So if you could take your finger to your nose, and then do the other hand too. Alright, and then if you could take your finger to your thumbs as fast as you can. Alright, and then if you want to stand up for me, you just want to walk to the table for me. And then on your way back, just go heel to toe. Alright, and then if you just want to put your hands out, close your eyes. I'm just going to be testing your sense of balance. you just turn to the side, I'm just going to be checking your spine. If you could just bend forward for me and hyper. Awesome. You could sit back on the side if you'd like. All right, so that's the end of the assessment. Your joints are really healthy just with the cracking of your knees, but I don't see any concerns with that. I just advise you to just stay away from smoking and secondhand smoke because it can lead to heart disease and lung cancer. Also to try to exercise 3 to 4 times a week. Have a good pair of running shoes just so it keeps the pain off your joints and stuff like that, and have a healthy diet with lots of high fiber foods, vegetables, fruit, calcium, and to also perform a monthly skin test. So I go by the A, B, C, D, E. So asymmetric, make sure the borders are clear. C is for color, no irregular colors. D for diameter, and for E for elevation. So no bumps or anything. Do you have any questions at all?
No.
Okay, so side rails are up. That is lock. Collards right here. If you have any questions, please don't hesitate to ask.
Okay, thank you.
Yeah.